Hi everyone, this is Ayushi welcoming you all in today's talk on cracking medical PG entrances with Dr. Mukesh Bhatia. Let me introduce our panelist, Dr. Shravani Reddy. She is currently leading our medical operations at WhiteCoats. She is a clinician by qualification and a healthcare strategist by training and experience. She will take the conversation forward today with Dr. Bhatia. Hello, Dr. Bhatia, and over to you, Dr. Shravani. Thank you.
Thank you so much for the introduction, Ayushi. First of all, a very warm welcome to everybody who's logging in today. This is Dr. Shravani Reddy from WhiteCoats, and I've got Dr. Mukesh Bhatia with me to discuss cracking medical entrances. Dr. Bhatia, welcome to the session. Thank you so much for taking time to join us today. Before I give you your due time, before I introduce you, a little bit about what WhiteCoats is and what we do. We are India's largest 360 degrees professional success platform for doctors. We are a networking platform for doctors wherein we offer personalized growth services with about a community of over 3.5 lakh doctors on our network. We showcase professional opportunities, skilling opportunities, and of course, knowledge articles and knowledge nuggets as well. In addition to the best-in-class technology products that WhiteCoats produces in-house as well to enhance and support doctors' practices outside. We work as a partner for your professional success, and part of our journey is also to support you in upskilling. So that is the reason we are talking with Dr. Bhatia today. Dr. Bhatia doesn't need an introduction, but formally let me give an introduction to DBMCI, Dr. Bhatia's Medical Coaching Institute, India's oldest and undoubtedly the top PG coaching institute for medical entrances, and eGurukul is their app. They are the pioneer in this field ever since 1996, and all of us who graduated, post-graduated have been either students, recipients of Dr. Bhatia's coaching in one way or the other. So we all know the institute, and the man himself, Dr. Bhatia, who's currently the chairman of the institute, he has a world record on his name for recorded lectures of whole internal medicine being awarded Academic Entrepreneurship Excellence Award and Visisht Chikitsa Ratna Award. Dr. Mukesh Bhatia has also authored Mini Harrison ko Medicine Simplified karke. He has authored a new writing and Medicine Essence as well. He's also a senior consultant physician, diabetes and a heart specialist with Fortis. His coaching institute, DBMCI, teaches aspiring doctors for higher education in India and abroad and helps them in cracking PG entrance examinations, not just here in India, but outside as well. Dr. Bhatia, it gives me immense pleasure to be joining you on this talk today, and thank you so much for your time, sir. Welcome.
Well, thank you very much, Dr. Shah. Let me tell all the audience that Dr. Shravani herself is MD Medicine. She's very learned, amazing personality, lots of experience, vision. I really salute Dr. Shravani for your such a enterprising personality. So let's start today's session.
Thank you so much, sir. Thank you for your kind words. Let's get started. I think the whole discussion today is going to be about, we've all heard your name. We all know what magic you do with PG coaching. And one question that starts in the mind of every medical student from second year and third year medical school is what we are looking at on the screen. Is a specific coaching, separate coaching required to crack a PG seat either in India or outside? Do we really need a coaching, sir?
Yeah, very good question. The answer is yes. No doubt about it. There are many reasons for that. First of all, whatever is being taught in the colleges, that is all didactic lectures. First time a student get to know about the subject. It is just like playing a test match, if you talk in the language of cricket. But as far as we are concerned about PG enters is all MCQ based question, just like playing one day or a 2020 match. So exam pattern is different. Question patterns are different. Students need to have the best of the training program. And one more point, PG enters is a game of musical chair. There are, I hope you all are well aware, 2 lakh students write the exam. And if you want a good branch like medicine, ortho, radio, you've got to be within first 5,000. Good branch in a good college. So that means you have to beat 1.95 lakhs doctors. Remember, it's a fight among equals. So training counts a lot. Champions are not born, they are made by the proper coaching. What I always say, Arjunas are not born, they are made. And this country does not lack in people who want to become Arjuna. They don't get Dronacharyas. So we are like that only. We train to take you to the top position in any exam in the world. Okay. So as you are well aware, we are doing the PG coaching, but again, we are also into the USMLE, MRCP also. So every exam, they need a full preparation guidance because every exam pattern is totally different. Next question.
Right, sir. Now that you've brought the concept,
yes,
you've brought out the concept that coaching is definitely necessary. Dr. Bhatia, another doubt a lot of our students have is, we traditionally join one coaching center for a PG NEET or for one set of exam, and then we go through that coaching 3 months, 6 months, whatever that is. And then we think that, when we want to attempt examinations outside, for example, USMLE to get into a residency program in US or a PLAB or an MRCP for UK, a lot of times what parents and students also assume is that, one coaching is enough to cover everything. Is that so? And how different are the preparations for these examinations, Dr. Bhatia?
All these are different exams. Preparation level is different. Well, you are sitting in the room, there's a table in front of you. The level of NEET PG is the height of the table what you are. But now, if you look at the ceiling, this is the level of MLE, MRCP, all totally different.
Guys, I hope Dr. Bhatia is audible to you and maybe to me not, because I think I've lost my connectivity. Can somebody confirm on the chat box, please? Okay, I think we seem to have lost connectivity. Let's wait for a minute for Dr. Bhatia to join back. Okay, students, I hear you. I'm here. I think Dr. Bhatia has some connectivity issues. He's going to join back. Kindly bear with me. Before he comes back, Ayush, your team, WhiteCoats, if you can just reach out to Dr. Bhatia's team and see that he logs in again. Meanwhile, for the benefit of the students, we've moved from one question to another. First is definitely, do we really need coaching for cracking PG while we continue to study in our medical schools and cover our syllabuses? We just heard that, we definitely need a coaching because we need to understand how the questions are asked and how the answers need to be framed for each one of them. And each exam pattern is different. And we were talking about the different examination patterns, PG NEET for India and MLE and PLAB for outside. And this is where we've lost Dr. Bhatia. So he's here, I'll let him talk. Hello, sir, am I audible? Sir, am I audible to you? We can see you.
Yeah, you are audible. You are audible. Now, am I audible to you?
Yes, sir. Please go ahead. We were talking about the second question.
Yeah, sorry, there was some deception.
No problem.
Extremely sorry. Well, we were talking about the question 2. The difference in the level of preparation is totally different. But I told you that you are sitting in the room, there's a table in front of you. The height of table is the level of NEET PG, and if you look at the ceiling, the height of ceiling is the level of USMLE, PLAB, and MRCP. The main difference between Indian exam and the foreign exam, in Indian exam, they ask one or two liner question and simple answer are there. But in them, it's a all long paragraph. Long paragraph is there, and you need at least more than 1 minute to read the question, because you are given 90 seconds to read one question and answer, in contrast to Indian PG exam where you get 35 seconds. This tell you the concept-based question. So there's nothing like subject. They talk about concept. Okay. So the level is altogether different, right? So different type of question, different type of preparation is there. So total different. You cannot clear your USMLE MRCP with Indian NEET PG preparation. No way. Next question.
Sir, now that we've discussed about different patterns and how different preparations have to be there for clearing different exams, the reason I put this question up is I know that a lot of our students are looking forward to clearing the NEET PG, and it's been pushed, the date is pushed, and we are in the last couple months stretch. And a lot of times we as students prepare all through the year. That is one thing. And then the last couple months or 1 month becomes all the more crucial, and it can change the game, right? And how important are these last couple months or 3 months, sir? And how does one plan for this? Sir, we can't hear you. Sir, am I audible to you? We can't hear you. Your video is stuck. Okay, I think Dr. Bhatia is facing some connectivity issues. We'll just wait for a minute for him to log back.
Hi, Dr. Shravani. I guess Dr. Bhatia has lost his internet connectivity.
Yeah, I hope he's trying to re-log in. Yes. Meanwhile, should we take some questions from the audience, Ayushi?
Yeah, sure. So we have got one question. Harish is asking. He has completed internship. So the best way to prepare for NEET PG.
Okay.
Yeah, Dr.
I think he would be expecting an answer from Dr. Bhatia, but definitely let me add my 2 cents to it, right?
Yeah.
Harish, hi, first of all, thank you so much for joining us today and for the question. If you're already done with the internship, and now if you're trying to prepare, I'm not sure if you've already been taking some classes and trying to cover some subjects before or during your internship. If not, I think here are the 2 cents from my own journey, right? We typically, once we are done, we picked up either a short program or a long program, depending on the exam date that is ahead of us, and to best utilize the time we've got, irrespective of the preparation standard that we were at. For example, if we are looking at writing an exam in the next couple of months, probably getting into a short program right now and quickly brushing up whatever knowledge we have and give the best attempt at the exam is the best thing to do, so that we don't lose out the opportunity of giving one shot at the examination, so that we know the pattern and how it is done and how it is written. And once we finish the examination and see where we stand, I think then you can take a call and decide about what kind of a extended program you want to pick. I think Dr. Bhatia is back live. Hello, sir. Am I audible?
Yeah, you are very much audible. Again, sorry, some technical issues.
No problem,
Okay.
sir.
So I can continue with my answer. The question asked to me the last couple of months.
Yes,
For
sir.
point number one, in the last few days are left, then do not read any new topic. Don't read any new topic. Revise what you have read in the last many months. Okay. Second point, now when you are revising, try to read the salient important point of every topic which you must have marked it. That is very essential. In that way, you are able to revise the thing very fast. And third, and the very, very important, try to speak in front of your friends, colleagues during breakfast, lunch, and dinner and tea. Teaching someone is the best way of studies. In that way, your memory will remain for longer time. Your confidence level will go very, very high. So this is the advice what I have for all of you for the last couple of months. Next question.
Sir, there is a question in the chat box from Dr. Harish, which I was trying to address before you were re-logging in.
Yeah.
This is Dr. Harish, who says he's finished his internship, and what is the best way to prepare for NEET PG now? I was telling him that since we've got more than a couple months left, he should still prepare and give the shot at the exam so that they get the flavor of how the examination pattern is, and then go for it. Go ahead, sir. You answer.
Dr. Harish, are you appearing for the exam on 21st May 2022 or 23? Which exam you are talking about? First, be clear about it. Can you answer me, Dr.
Yeah.
Harish? Is your line?
Harish, if you're in the, so he's on the chat box. Harish, you can try and answer. Dr. Bhatia is asking which year exam are you prepping for, this one or next year's?
22 or 23?
Before we get an answer, Dr. Bhatia. So you said 3 things, what to do and what not to do in the last couple of months. One is don't pick up any new topics and brush what you've already done. Second is only look at the salient features from each topic and just memorize them. Third is try and indulge in conversations and explanations with your friends so that your memory gets better.
Yes.
Now, once we have done that, sir, a lot of times students must come to you asking this question, and a lot of us ask us also. What are the quick tips to cracking NEET PG? What are those key tips?
Okay, fine. Now, Dr. Chat box, I got an answer from Dr. Harish, and he said he's appearing this year only. That means he's appearing on 21st of May 2022.
Right.
So now, as I already told you, him, what is the how to appear, utilize these last 2 months. But well, now the question 4 in front of me, tips to cracking NEET PG. Well, this is especially for those who are appearing for the 23 exam. I answered. For 22 exam, I already answered to you. This, I presume that those who are maybe 23, 24 exam. But before I proceed, you are well aware that DBMCI has e-Gurukul version 1.0, 2.0, and now I'm very happy to announce that today only at 6 o'clock we are making live a DBMCI e-Gurukul 3.0 version. Okay, 3.0 version we are launching, and it is a state-of-art lecture, state-of-art app we made. We spend, my team, our team has done a huge amount of hard work to create a state-of-art lectures, totally revised lecture, total new app. And this is, again, this give complete material. This give you complete material, theory, question, test and discussion, quiz, everything is given in this, more than enough for everything. Plus, this also gives you USMLE, MRCP, step 1, step 2 courses are also there. It also has smart medicine, which is complete medicine recording. Medicine is the ultimate book to read, but it's too vast. Reading one page of Harrison, you need half an hour. To understand, you need 2 hours, but you need only 2 minutes to forget what is given in that. So I have come up with the smart medicine also. Well, now the question is to crack NEET PG. Read our e-Gurukul and smart medicine. If you do this much, you are not only you will crack the exam, you are among the first 500 in All India PG exam. Okay, WhiteCoats and we DBMCI are together there to help you out in all the possible way. So now to summarize, tip to cracking NEET PG is take our e-Gurukul 3.0 version and read plus smart medicine. That's all. You don't need anything else. Any other question? Next question. Tips. Okay.
Dr. Shravani, you are on mute.
You are not.
Sorry.
You are not audible.
Dr. Bhatia, there are a few questions from students that have been, we've received some questions. I'm going to read out a few questions. We'll take that and we'll go to the next one. Here is one question, Dr. Bhatia. How to prepare for PG while doing internship? What should we prefer more during internship? Learning, work, or studying?
Very, very good question. This is the universal question I have answered to 3 lakhs people so far. Teaching is the best way of studies. I repeat my statement. Teaching is the best way of studies. So when you are at home, you read, run from our e-Gurukul, make notes. And when you are in duty, during breakfast, lunch, and dinner tea, you keep on speaking in front of your colleagues. With the result, your short-term memory will become long-term memory. People read, but they do not convert short-term into long-term memory. You do this thing. So during your duty time, so summary is read, prepare notes when you are at home, and when you are at duty, you keep on teaching, and the whole thing, that whatever you read that day, it will go from your gray matter, white matter, spinal cord, cauda equina, in the muscles also, your topic will enter. This is the best cracking tip to crack NEET PG exam.
Okay. So second question. There's another question from another student. Sir, we have 19 subjects to study. This is a student again who's beginning internship. They're saying we have 19 subjects to study. How do we allocate time to each? How do we divide time with each?
Well, when I recorded my lectures for smart medicine, I recorded for concept. Like when I am teaching, say, HIV. In the HIV, I included anatomy, physiology, biochemistry, immunology, immunopathology, microbiology, virology, genetics, pharma, medicine, pediatric, gynae, psychiatry, everything is there. So there is nothing like separate subject. And I hope you are well aware, even Indian exam, they are gradually, they are shifting to USMLE pattern. They don't like the question. They don't want anatomy, physiology. They want concept. If your concepts are clear, you are the top ranker. It's the need of every exam, including Indian PG exam also. You see 1 video per day of smart medicine. You are the top ranker. And we can share some of the free videos to you. You can see, review, and of course, to supplement, you can take away e-Gurukul. This combination is good enough to crack any exam in the world. Okay. So again, same story, see 1 video per day at home and teach to your colleagues during duty hours.
Okay. Sir, one interesting question is, it's a very competitive world and there are too many coachings and too many books and too many materials out there for preparation. A student is asking, how do I know that my preparation is enough and what is the right way to prepare?
Okay, again, same answer. You see some of our free videos and you will come to know that the content of DBMCI is moon among the stars. Okay, see to believe it. we don't say that you believe blindly. You can share the numbers to us. My team will share some of the free videos to you. See the video, then you will understand. But I want to say that how DBMCI will prepare you for a concept, not a subject. Concept should be very clear. You should be able to integrate physiology with biochemistry, with patho and medicine. Everything you should be able to integrate, and that's what we have done it so far. Okay, I think is the best way.
So that is the question. That is the question on the screen also, sir. How is it that DBMCI unique? Now, you've answered.
Nobody else is doing this, but the content what we will be giving to you is unique. As they say, I can challenge also. I can write on a stamp paper. The content of DBMCI is the moon among the stars. I can write on a stamp paper. If we are wrong, I'll hand over the institute to that person who will prove it wrong. Okay. And this can be said when you are confident that my content is the best that we can assure you. And we will give you a lot of free videos for you to yes. And you say they compare with other institute also.
Okay.
Okay. When you have the evidence, then you believe it. Yeah.
So there is another interesting question. I think there are a lot of students who expect an answer to this question. This is about students who are attempting FMGE. I've attempted FMGE 4 times, and this June is my 5th attempt. How can the coaching help, and how do I clear this exam?
What you can take our question bank of FMGE exam, because time is too short. June means it is already April, May. It's hardly 2 months are there. Now in this stage, even those who are preparing for NEET PG, you should do lots of questions, practice question. You do our test, quiz. We have a quiz in our DBMCI. A lot of quizzes are there. Only at this stage, only do questions. Okay. For FMG, for NEET PG, do questions. We have a lot of questions in our e-Gurukul.
Okay. Sir, another question. Students who are working, who finish their internships and who are working now, they find it difficult to give enough time because they have to manage both. Now, there is a question from their end, sir. Unable to cover the syllabus due to our work schedules. Any advice for us?
This is problem with not only for one student, it's for everyone. Everyone is in the same boat. Nobody has time. You have to create time. Okay. And I told you, when you are at home, you read it. And when you are in the hospital, you revise it. So you revise in such a way that you don't need to read it till your exam. It is in your fingertips. Now I tell you one thing, which you are not aware. You know, the Indian way of studies is the best in the world. You must be remembering the tables. Everybody remember the table. I remember, you remember. Tables, mathematics tables, 212, 224. Why? Why you remember? That we read decades back. Because in our school days, we were made to stand in the open ground, and our teacher used to ask, revise. Same thing, now it has gone from our gray matter, white matter, spinal cord. Our spinal cord knows the table. We don't have to read it. Same thing I've told earlier also. You read one topic when you are at home and keep on teaching to your colleagues in such a way that you don't need to revise till your exam is there. In that way, your job, which you are thinking is consuming time, you will find it is more interesting. You get a platform to revise. So don't take job as a disturbance. Rather, you get an opportunity to revise in front of your colleagues, which people sitting at home do not get this opportunity. So use the job as an opportunity, not as a hurdle. Next question.
Okay. Sir, another question is, if we have already attempted this year, taken a coaching, attempted the exam, and have not been successful in clearing it, do we really need to join another coaching the next year as well, or how do we go about it?
No. Again, you are starting the same story. Again, you have to revise again. Revise, first of all, you got enough material from one place. And now, if you could, that means if you could not get success, that means there was some problem. Ask to yourself, have I completed the question bank? Have I studied what was given to me? The answer is yes, then you go to other place. If answer is no, then Then you revise, and at this stage again, revise only the question bank. I got a question. Yeah. Next question.
Okay. Sir, another question is, what is the best way? So they're asking about imagery, sir, radiography. What is the best way to learn radiographic images? Any tips about that?
Well, when we are like the lecture I recorded for smart medicine, not only radiology, it is full of images. Whatever is there, I give an image. Even like in case of megaloblastic anemia, they say macrocyte, there will be photo of macrocyte. Hypersegmentation or neutrophil nucleus, it will be there. Whatever is written, I have given the picture, so that at the same time, you are learning what is written, and picture are always the best to remember. So DBMCI e-Gurukul has given lots of pictures are given, including smart medicine also. So you don't need to read. Radiology and skin cannot be learned unless you have the picture in front of you. So we have plenty of pictures in radiology, plenty of picture in eye, medicine. Everywhere we have lots of pictures out there. Okay. Next question.
So another question from students is, what is the ideal preparation time for cracking NEET PG, sir? 6 months, 3 months? What do you think is the ideal time period?
If you talk about 3 months, 6 months, then everybody will get PG. It's not like that. If you think if you can prepare in 3 months, 6 months, then you are in a delirium. No, it needs a constant effort. Champions are not made in the preparation of 3 months. It needs daily labor on daily basis. Remember, again repeating second time, PG entrance is a game of musical chair. You should know more than what others know. Then only you will get a seat. So no 3 months, no 6 months. Who told all this concept of 3 months, 6 months? So dear student, you need to start preparation now. Even if you are undergraduate, start preparation now, and we will guide you. And rather, I give a personalized mentoring also. I do day-to-day mentoring also, I do it. You say, suppose you are undergraduate, you say, I want MD medicine in AIMS, I want MD radiology in PGI Chandigarh, or I want MD in this college. I'll guide you, I'll do personalized mentoring. And not only that, I'll train you in such a way that you get gold medals and you top in all your university exam also. This is the unique thing what DBMCI does for students. Okay.
Sir, in the same context, there is a question. There is a third year student and the second year student who have posted similar questions. They said, how do we prepare for PG while we are still in undergraduate study?
Same thing. What I told you, join our course. You take our course. We have advanced pack for 2, 3, 4 years. You take it and I'll do personalized mentoring for you. You say, sir, I want this MD in this, I'll MD medicine or MD radio in this college. I'll guide you. I'll do personalized mentoring. What else do you want? A senior person like me is guiding you on day-to-day basis. What else do you want? In this way, you'll be able to crack not only a PG of your choice, you will be getting gold medals in your university exam also. Okay. Yeah.
Okay. There is one more question saying, sir, how do we start or when do we start preparing for USMLE? During UG or after finishing UG?
UG, people have joined my course from first year MBBS also. You cannot prepare a USMLE in the internship. No way. It should be done first year, second year, the best time. Under graduation, and you should write your USMLE exam in internship. But sir, my senior says you should write in third year, first step 1 is most common wrong answer. Should write your MLE exam in first step in first half of internship. In the second half, go for rotation. And at the end of internship, or then you should write USMLE step 2. This everything we will guide you.
Okay.
Everything we will guide you what to do. But start preparation right now.
Okay. Dr. Bhatia, could you please talk about smart medicine a little bit?
Well, smart medicine are the recorded lecture of whole Harrison. everybody want to read Harrison, but Harrison is of course, is one of it is the best book to read medicine, but it's too vast. I told, reading one page of Harrison, you need half an hour. To understand, you need 2 hours, but you need only 2 minutes to forget what is given in that page. It's a problem, and moreover, too vast. What I have done, I have made summary of the whole Harrison, what you need for the exam. This is so-called mini Harrison. We have a book also we are coming up because with the end of this month only, we'll come up with the simplified, because medicine simplified is the textbook, mini Harrison, but we have recorded lectures, smart medicine. There are 350 hours of lectures. You read, and that is an integrated approach, everything starting from one concept. I've covered all the concepts. And if you know this, you are the top ranker in all the exams throughout the world. Smart medicine, right. Recorded lecture for many years. Right.
Right. Sir, thank you so much for giving us that valuable information about everything. Any parting message for our students before I close?
Well, I will strongly recommend that you should follow Dr. Shravani. She's a wonderful lady. WhiteCoats is there to help you out at grassroots level. Any query you have, you take the number of Dr. Shravani, talk to her. She herself is MD medicine. She was a brilliant student in her time. So at the same time, she's an entrepreneur and she has all the vision, experience. Take her expertise. You should be in touch with Dr. Shravani and WhiteCoats, and they are our business partner. Okay, we will be supporting. We are working together. But take the advantage of experience of Dr. Shravani. Well, thank you very much to all of you. Thank you, WhiteCoats, for arranging meeting. Thank you very much. Okay.
Thank you, Dr. Bhatia. And to everybody who's attending today, allow me to say that, with this unique partnership between WhiteCoats and DBMCI, we are offering a unique discount to students who are trying to pick up the coaching programs from Dr. Bhatia's. So please log on to whitecoats.com website, download our app, go to DBMCI channel page and look at the discounts that are available. And you can log in through our channel and avail those discounts. Hope you've got all the information that you've needed to crack NEET PG from the expert himself. If you have further questions, please reach out to us on our social handles and let us know how we can help you. Yes, sir.
Again, just to inform all of you that eGurukul 3.0 law is live now. You can take that also. Okay, the new version. Thank you very much.
Right. Thank you very much, and thanks everybody for joining us today. I take leave. Thank you very much. Bye bye.
Join the latest eGurukul 3.0. Okay. Today we are making it live. Thank you very much.